A breast change can feel like a trapdoor moment. One second you're fine, the next your brain is sprinting ahead. What if it's cancer? What if I waited too long? For some people, it's a lump. For others, it's a nipple that suddenly looks different, a patch of skin that won't settle, or a nagging sensation you can't explain. And if you're here, you're probably doing what most people do, trying to act normal while quietly scanning every worst-case scenario. This video is your reset button. I'll walk you through what to notice, what's commonly benign, and the specific signs that do deserve an urgent doctor's appointment, without panic and without guesswork. Most breast changes are not cancer, but the safest move is simple. Take new changes seriously enough to check them properly. Breast cancer happens when cells in the breast start growing in an abnormal way. It can start in different parts of the breast, including the ducts that carry milk and the lobules that produce milk. It is the most common cancer in women in the United Kingdom, and risk increases with age, especially after 50, but younger women can be affected too. Also, anyone can get breast cancer, including trans men and non-binary people with breast tissue. The key message is simple: if you notice a new change, you deserve to have it assessed. I want you to think about what your breasts normally look and feel like, because that makes it easier to notice change. The changes that should prompt a doctor appointment include a new lump or swelling in the breast, chest, or armpit. It also includes skin changes such as dimpling, redness, or a texture that looks a bit like orange peel. It includes a change in size or shape of one breast compared with the other. It includes nipple discharge that is new, especially if it is from one nipple or has blood in it. It includes a nipple that starts turning inwards when it did not before, or a persistent rash or crusting around the nipple area that does not settle. If you are thinking, I have always had lumpy breasts or my breasts swell before my period, that can be completely true. The question is not whether your breasts are naturally lumpy. The question is whether something is new for you, whether it persists, and whether it feels different from your usual cycle-related changes. Breast cancer does not always cause pain. Some lumps are painless, and breast pain on its own is not usually a sign of breast cancer. However, pain that is there most or all of the time, especially if it is new for you, still deserves checking. Another myth is that a normal screening result means you are definitely fine. Screening saves lives, but it's not perfect. Cancer can develop between screening appointments, and symptoms still matter, even if you recently had screening. And finally, a lump does not automatically mean cancer. Many breast lumps are benign, meaning non-cancerous. The problem is that you cannot tell which is which just by looking or feeling, so the safest step is assessment. If you book an appointment, your doctor will usually ask about the change, how long it has been there, and whether it is getting better, worse, or staying the same. They will examine your breasts and armpits. If your symptoms fit criteria that suggest breast cancer needs to be ruled out quickly, they can refer you on a suspected cancer pathway. People often call this a 2-week wait referral, but the important thing to know is what it means in real life. It means the NHS is acting promptly to get you assessed. An urgent referral does not mean you have cancer. It means your symptoms deserve timely investigation, because early diagnosis matters. At a breast clinic, you may have a specialist examination, and you may be offered imaging such as a mammogram, an ultrasound scan, or both. You might also need a biopsy, which is when a small sample of tissue is taken, so it can be examined closely. If you are invited for routine NHS breast screening, that uses a mammogram, which is a breast X-ray. It can feel uncomfortable, but it is quick, and any discomfort should not last long. If you have mobility needs, a learning disability, implants, a pacemaker, or you are pregnant or breastfeeding, you can tell the screening team so they can advise and support you properly. Now I want to speak to the person who is thinking, please tell me it could be something else. Because often it can. Hormonal changes can cause breast tenderness, heaviness, or lumpiness that fluctuates with the menstrual cycle. Breast cysts can appear and disappear. Fibroadenomas are common benign lumps, especially in younger women. Infections can also affect the breast, especially during breastfeeding, where you may notice redness, warmth, pain, and sometimes fever or feeling unwell. Skin conditions can cause irritation or rash around the nipple area too. Even if a benign cause is likely, any new or persistent change still needs checking. You are not being dramatic, you are being sensible. If you notice a new breast lump, a new armpit lump, skin dimpling, orange peel texture, if you see persistent redness, a nipple that is newly turning inwards, or new nipple discharge, especially if it is blood-stained, ask for an urgent doctor appointment. If you are unsure what to say, keep it simple and direct. Say that you have noticed a new breast change that has persisted and you would like an urgent assessment to rule out breast cancer. If your main symptom is breast pain or tenderness that comes and goes with your menstrual cycle, affects both sides, and you have no new lump, no nipple change, and no skin change, it can be reasonable to try simple self-care first while keeping an eye on it. Supportive bras can help, including at night if that feels better for you. Heat or a warm shower can be soothing. Simple pain relief, such as paracetamol, can help, and ibuprofen may also help if you can take it safely. Some people find anti-inflammatory gel useful for local soreness. If you have pain that is persistent, one-sided, new for you, or paired with any other concerning change, do not just self-manage. Book in with a doctor. In the United Kingdom, the NHS offers breast screening to eligible people, typically from age 50 until their 71st birthday, and usually every 3 years. If you are over 71, you can still request screening, even though you will not be automatically invited. Screening is offered because it can find cancers earlier, when treatment may be simpler and more effective. It also has limitations, and the NHS provides information to help you decide, including the possibility of being called back for further tests that do not turn out to be cancer, and the fact that no screening test is 100% accurate. Whatever you decide, keep this habit. Most breast changes are not cancer, but new changes need checking. Do not wait for pain and do not wait for your next screening invite if something has changed. And remember that the NHS pathway is designed to assess promptly and properly, so an urgent referral is about speed and safety, not a diagnosis. If you have noticed a change, book a doctor appointment. If your symptoms match the red flags we covered, ask for an urgent appointment. If you receive a screening invitation, read the information and choose what feels right for you. And if anxiety is making it hard to cope while you wait for answers, tell your doctor that too, because support matters. If you are watching this for yourself, I want you to hear this clearly. Getting checked is not making a fuss, it is exactly what you are meant to do. Hormonal shifts can make your breasts feel more tender or a bit lumpy at times, and PCOS can be one reason for that. But PCOS doesn't explain away a new breast change. If it's new, persistent, or worrying, get it checked. Tap my PCOS video on your screen now for a clear breakdown of symptoms, tests, and what to ask for.